Sabry, the floor is yours. And now you should be able to share your presentation. Welcome to Biotech Atelier. The floor is yours.
Thank you so much. I would like to start by thanking the organizers. It's really a great pleasure to have Roche and to have myself in the event and among the exciting group of speakers and friends and collaborators. So in the coming minutes, our intention is to share with you the current thinking and the reflection on the topic of digitizing healthcare. And actually, this is a very collaborative space. So this is really the work and the thinking and the consideration of our Roche Bulgaria team in collaboration with a lot of private and public partners, and definitely in collaboration with the digital health and the innovation cluster. In the coming minutes, we will try to shed some lights on the why this is important, on the what are the current challenges, struggles, and also on the how we can move forward with a clear vision. As you know, digital healthcare has a huge potential. It changed the way we prevent, we diagnose, treat, and manage health problems. It has also a huge potential to shift the focus from treatment in multiple healthcare systems to have now the compass more moving to the concept of prevention. We have seen definitely an acceleration during the COVID-19 pandemic. And for the first time, we have seen a lot of use of telemedicine, online consultation, and multiple innovation related to digital healthcare. Yesterday, also, I was inspired and very happy to see our Bulgarian Minister of Health and our Head of Physician Union launching the mobile application for the health records of the patients. I believe it's a great step. And as the Mr. Minister mentioned, it's the right step in the right direction of digitalization of the healthcare. It will also give the patients and the citizens really the access to their medical records. To really great step in the right direction. And actually, the more we discuss about digitizing healthcare, we realize the potential in really a broad perspective on how this can have an impact on the patient's outcome. But very important question, are those digital healthcare innovative solutions enough? Can they exist in the space? Actually, the answer is not. In order to have a meaningful health data ecosystem, we need to have standards and we need to have governance. The way we are dealing with data, the way the data is following really certain standards, the way we can connect the data and really drive insights, this is which will take us forward. The other scenario, if we only have those innovative solutions and not having the proper standards and the proper governance, we might even end with those data became as a burden for the healthcare system. Let's take a look on how health data can be distributed in an ecosystem that benefit all stakeholders and definitely including patients. The meaningful health data governance model really is made up of several layers, as you can see in this slide. Health data include patient clinical data that can come from provider, from patient, and the medical devices registries, usually is being maintained either by public or private non-governmental organization. A very important source is the genomic data, and a lot of discussion in recent years about the genomic data and how it can change the face of medicine. Health data from digital devices, from applications, and from social media. But a very important question here, how a healthy health data ecosystem would look like? This is really an important question because we need our health data ecosystem to be connected, to be supported by the right legalization. We are talking here about policy and laws. We need to have the proper and right funding and definitely infrastructure. If we ensured those conditions for our health data ecosystem, we will end up ultimately with higher quality of data, with improved patient experience. Very important also point is the funding and is the efficiency in the healthcare system, which is a very important topic in Bulgaria. And with the proper health data ecosystem, we will end up with reduced healthcare system cost. It will facilitate a lot of research and innovation. And finally, it will enable policymakers to really make an efficient decision for today and also for the future. Actually, having in mind that digital healthcare have a big potential to change the way we are solving our health problems, having in mind also that governance and infrastructure is very important, our team in Roche, Bulgaria, in collaboration with IQVIA, decided to go back to basics, to do a health transformation assessment for the digital healthcare ecosystem in Bulgaria. And that only can be done through a number of questions and interviews and reviewing what we have already in place. And I believe the most interesting part was to connect with different public and private partners. And we had a very insightful discussions, either about our challenges in Bulgaria, but most importantly, about the vision for the future. This assessment included also some very good examples and best practices from Europe, which can inspire us in Bulgaria and give us kind of candle and vision for the future. The area of investigation for this assessment has been 4 areas. The first area is to really understand the Bulgarian health data ecosystem current state, assess the gaps and the recommendation on how we can really tackle the key challenges, outline European best practices, as I was mentioning, because we can learn a lot and we can get support either from our European neighbors or from the EU Commission, and finally present a future state vision. In order to have this extensive assessment, 2 elements were very important. The first element is governance. And as you know, governance is about enabling policies and frameworks. And in governance, we had 3 main pillars. The first one is policy and law. Here we can think about the GDPR aspect and the other important laws to facilitate health data from policy perspective. The second aspect was institutions and stakeholders. And here accountability is very important. Is there a clear accountability from stakeholder perspective and institution? Who owns the health data in Bulgaria? Who are the needed stakeholders to be engaged from accountability perspective? And the last pillar was funding. So we wanted to understand if there is clear funding either in the state of Bulgaria or coming from the EU, and what are the sourcing of this funding for the health data ecosystem in Bulgaria. The second element of assessment has been the standards and the infrastructure of data. And as you know, there is a very clear data standards from European perspective when you reflect on the electronic health records. We wanted to reflect also on the architecture and the infrastructure and how the data integration can be achieved. What are the control and process management in place? And the last pillar has been data security and access. You know, data security is very important. So question about points like authentication, for example, or cybersecurity. Before we reflect on the results of the assessment, we wanted to share or to go back and to share a big picture about how the digital maturity would look like in Bulgaria. And maybe it's not a surprise that our digital maturity in Bulgaria from health data perspective is being rated as underdeveloped and challenged. And this is similar, as you can see here in the graph, some of our neighbors in Central and Eastern European countries. This assessment has been done considering 12 pillars related to digital maturity and also considering the GDP in each country. Because as we mentioned, governance is very important, including funding, and then infrastructure, and we move forward to execution. The second point, and this is very encouraging and could be inspiring for all of us, that we have a lot of inspiring and bright spots across Europe. Across of neighbors, either in the north, in the west, has very good examples. One famous example is the Nordics, and if we zoom further, we will have Finland having FinData, when a lot of health and social data are coming together, and then you have it for many of the stakeholders. We are talking here about researchers, about business, about the secondary use of health data, which can really facilitate more efficiency, clear decision making, and giving the individual patients more power over their data. Another example is in France, the Health Data Hub, where again integration of different sources and structures to have data in one place, including the genomic data. So those examples meaning that there is light at the end of the tunnel, that we can really learn from our partners in Europe, and we can apply some of those best practices. But maybe before we go forward to the vision and to how to move forward, I believe we reflect on two key pillars and two key outcomes from this assessment. The first one is the governance. And here I believe it's important to mention that we are sharing only around 10% from this report, because it's an extensive one. It's around 100 pages. And maybe this is an invitation here from myself and from the team in Rouge, Bulgaria, to run more discussions and conversations around this report. So back to governance and from maturity level, the assessment from the report that the maturity level is from low to medium. And if we take it one by one and reflect first on the policy, so the basic principles of processing health data for primary and secondary use are secured in the Health Act. The second point, that the Health Act stipulate the creation of National Health Information System. And from my perspective, the National Health Information System is a great point for Bulgaria. And this really can be the backbone and the platform that can help the Bulgarian healthcare system to move forward. Because yes, as we mentioned earlier, our healthcare system is challenged and not matured, but having a national health information system in place under the umbrella of the Ministry of Health can be a very good starting point. The last point here, that regulations on data transfer, security, and standards are still not in place, and we assume this is a task and mission for the coming parliament after the election. The second pillar has been the institution and the stakeholder, and the key governing body struggle with expert roles and functions to support the development of digital transformation in healthcare, which is definitely strengthened by the national political climate and the frequent elections and the political volatility we are experiencing right now. The second point, that the national strategy on healthcare digitalization is expected to streamline the functions of these bodies. Again, vision is the key point. And today we are speaking specifically about digital healthcare, but even in a wide spectrum, and when we speak about the healthcare system in Bulgaria, the main point is the vision. And my optimistic assumption that from vision perspective, it would be somehow easy to come and say this is our unified vision, and then we can have multiple perspectives on the strategy, on the tactics, etc. Finally, and very important, is the funding. So the 2022 healthcare budget has dedicated close to 2 million euros to the digital healthcare, and there are several European funding programs exist that can strengthen the healthcare system and the use of digital technology. The second important element from this assessment has been the standards and the infrastructure. And as you can see here, it's not a very bright picture, I can say, because from health data standards and the infrastructure and the building a platform and standards, there is still some way to go. And you can see that the maturity level is more drifted towards the low level. And because the picture is not very bright, and the analysis showed and confirmed many assumptions that due to the lack of national standards, data in Bulgaria is fragmented. This is definitely a big challenge. not digitalized and disconnected from a centralized electronic health record perspective. Again, here having the National Health Information System can be a bright spot. The mobile application that has been launched to the public yesterday is another step in the right direction, but we need to accelerate. On the slide here, you can see more details. And for example, the sharing of data is not very organized and can be pushed and be more structured more. So now, maybe one question, are we alone in this journey after we have seen the challenges in Bulgaria? And the good news that we are not alone in this journey. There is a very strong European momentum going in the same direction. We are now more aware about our challenges, specifically for governance of health data and the infrastructure and the standards. But important steps forward have been achieved through the data analysis on the local level and also from European-wide health data analysis remain really untapped. There is a big potential. And so far around the examples that I have shared from Europe, but there is a big potential from EU Commission and the multiple European countries. Today, European health data space regulation is really signaling in this direction and trying hard to untap this potential on a central level and also in a multiple country levels. Before we move to the European health data space, I wanted to share here the work that has been combined between Roche and our partners in both the public and the private sector. And here specifically, the Digital Health and the Innovation Cluster, a very active partner in the space of Bulgaria. And this nice home or vision reflect really the work of different colleagues and specifically what Radoy Pavlov did as a vision for the future. The vision is based on digital health platform and common principles and reference health data standards and models. The blueprint on the right side give you idea about the architecture, defining a framework for legalization reform and resource mobilization. On the left side, the digital health platform will put integrated, connected medical data in the center of the ecosystem. That will allow for regulated and secured access to health information for patients, for healthcare professionals, for regulators, for researchers, for private sectors and the other stakeholders. Ultimately, the patient and the medical data are in focus of the patient-centered digital healthcare. Again, there is a lot of energy around this vision. There is a lot of optimism. There is a lot of momentum. There is a belief that this vision for the digital healthcare system in Bulgaria is something we can and stick together in order to move forward. Having our self-awareness about the challenges, having our common vision for the digital healthcare system in Bulgaria is great, but definitely a third part of this puzzle or a third piece of this puzzle, the corner in this puzzle can be a support coming from the European Commission. And in the last period, if you have seen in the media, in the TV, if we have heard in multiple discussions that there is a big momentum around the European health data space. A regulation coming from the EU Commission, as most of us are aware, putting the patients and the individuals at the center with assumption and with intention to really give full power and empowerment for the individuals and the citizens across Europe to have access to their data. The second priority is really changing the way the medical service and the medical care is being delivered in Europe, allowing for more research, allowing for more innovation, really giving more power to the policy making in order to decide today for the best decision for the patients and the healthcare system. But most important, also planning for the future and working on the efficiency of the finding. Finally, really working on the ability to exchange safe and secure data across Europe. We believe, and many believes, that regulation like European health data space will provide a lot of support to the different countries in Europe. Again, providing empowerment to individuals, really helping and unleashing the data economy by fostering a genuine single market for digital health services and products, really setting up the rules for the use of individual non-identifiable health data for research, innovation, policy making, and regulatory activities across Europe. Personally, I'm very enthusiastic and very optimistic that the time now has come to shape the future of Europe healthcare environment by working together as public and private sector to ensure the success of the European health data space. Considering that the intention is there, we have a clear vision for the healthcare system in Bulgaria, combining governance and infrastructure, that we have the right level of self-awareness about our current challenges and struggles, and finally using the support of Europe, being lucky to be part of Europe, using the support of the EU Commission, counting on the good and bright spots from other countries in Europe like Finland and the other countries, we believe that will really get a lot of value for our patients. So definitely better medical care, a lot of value to the healthcare system, and big push to research and innovation. Thank you very much, and the floor is open for any questions or comments.
Thank you, Mr. Sabry. It was really detailed and informative presentation. And as you said, the digital health is the future and should be the reality here in healthcare of Bulgaria. You've pointed several challenges, and I believe that this is the first step to start finding the solutions to these problems in order to have it here and now. And corresponding with the title of your presentation about the puzzle and the pieces, I would ask you, what are the three biggest pieces in Bulgaria that miss in order to combine and make the picture full?
Thank you. From my perspective, the first piece is the self-awareness. So really having clarity, and specifically from governance perspective, how we can enable the policy and the law in Bulgaria. And definitely for the infrastructure and data standards, so being very self-aware about the challenges. The second piece of the puzzle is the vision. And I presented here and I shared the vision coming from the digital health and the innovation cluster. And the vision speaking about this integration between different and multiple streams in the system. And the final piece and pillar from the puzzle would be really utilizing the European support. Thinking about regulations like European health data space, thinking about the bright examples from the EU. From my perspective, going with those three pieces of the puzzle, we have a good plan and a good potential to go forward.
Great, thank you. And here's one question from the audience. Do you think that the population, the people who should be there in order to share their data and to have digital health reality are ready for this? Do you think that Bulgarian population and people living here are prepared for the digital health reality?
Thank you very much. I believe this is a very important question and very important point. Actually, we have done some work on what we call the digital health literacy, and definitely there is work to be done. So the answer to the question, there is a work to be done. From awareness perspective, there is a work to be done. From public, building the policy and law, there is, work to be done. And definitely, finally, and very important, is really building trust with the public. So it's a great point, and definitely a lot of work on the digital health literacy, so we can make sure that our people in Bulgaria are more ready to get the full potential of digital health care.
Thank you. So yes, education and literacy, as you said, and trust are really key points in order to have the people involved in this process, because without people and their data, it's impossible to have digital health.
Exactly, exactly. And I think by trial, that the once you trial the benefits of such, again, tools, innovation, how this can change the patient's life, I think with having some small successes and examples, that will build also the trust and help the awareness as well.
And if you are able to make a wish or a prognosis, when do you see it in reality, digital health here in Bulgaria? For the next 5 years, 3 years, or shorter, why not?
I believe if we have the right policy in place, again, talking about the governance and talking about the right standards and the infrastructure, I believe in 3 years, we can really start to tap on the potential of the healthcare, digital ecosystem in Bulgaria. So I believe 3 years is a reasonable time, taking consideration, again, self-awareness about, what challenges we have today, full commitment to aligned vision and get support from Europe. I believe in 3 years we can change the way we deliver healthcare to the patients in Bulgaria today.
Great. This sounds great and promising. And let's make a wish to have it here soon and work about this. I
Yes.
believe that Yash, Rosh, and the entire team are really involved. Thank you. Thanks to you. Thank you. A big thank you to Roche Bulgaria for the support of Biotech Atelier also. And thank you for your participation today.
Thank you so much. It's our pleasure and definitely very important topic, the digitalization in healthcare. So the society have our full commitment as Roche Bulgaria to really advance that forward.
Thank you once again.
Thank you.